studying first year BPT in SNS College of Physiotherapy. I am going to present article about myocardial infraction. Now, what is mean by an article? An article is a particular item or an object. It is a piece of writing included with others in newspaper, magazine or other publications. It undergoes a period of training with a firm in order to become qualified. An article is a word that is used to indicate that a noun is a noun without describing it. For example, the sentence, Nick bought a dog. Most major newspaper publishes daily with expanded coverage on weekends. Newspapers can be national or international in focus or might be targeted strictly to particular community or locality. Newspaper articles are written largely by newspaper staffs and editors and often do not provide the author's name. An article is any member of class of dedicated words that are used with noun phrases to mark identifiability of reference to noun phrases. The category of article constitute a part of speech. In English, both the articles which combine with nouns to form noun phrases. About myocardial infraction. What is myocardial infraction? MI, that is myocardial infraction. It is defined as a condition which is caused by reduced blood flow in the coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. MI, that is myocardial infraction or heart attack, is an irreversible damage of myocardial tissue which is caused by prolonged ischemia and hypoxia. Hypoxia, which is deficiency or lack of oxygen in blood and tissues. Myocardial infraction refers to the process by which an areas of myocardial cells in the heart are permanently destroyed. It occurs when a myocardial tissues are abruptly and severely deprived of oxygen, that is due to hypoxia. MI, that is heart attack. It is defined as a necrosis of heart muscle resulting from ischemia. That necrosis means lack of blood cells, a very significant cause of death worldwide. Of these deaths, 35 to 50% died before they can reach the hospital. Lethal arrhythmia, which causes a sudden cardiac death. Arrhythmias are caused by the electrical abnormalities of ischemic myocardium and conduction system. The pathological diagnosis of myocardial infraction, which results evidence of myocyte cell death as a consequence of prolonged ischemia, that is hypoxic condition. Characteristic findings includes coagulation necrosis and contraction band necrosis, often with a patchy areas of myocytolysis at the periphery of infract. The majority of myocyte cell loss in the infract zone occurs through coagulation necrosis and proceed to the inflammation, phagocytosis of necrotic myocytes and repair eventually in the scar formation. A myocardial infraction, commonly called as heart attack, which occurs when the blood flow decreases or stops to the coronary artery of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort which may travel into the shoulder, arm, neck and jaw. Often it occurs in the center or left side of the chest and lasts more than few minutes. The discomfort may occasionally feel like heartburn. Other symptoms may include shortness of breath, nausea, feeling faint, a cold sweat or feeling tired. About 30% of people have atypically symptoms. Women more often present without chest pain and instead have neck pain, arm pain or feel tired. Among those 75 years old, about 5% have had an myocardial infarction with little or no history of symptoms. An MI, that is myocardial infarction, may cause heart failure, an irregular heartbeat, cardiogenic shock or cardiac arrest. A myocardial infarction occurs when atherosclerotic plaque slowly builds up in the inner lining of the coronary artery and then suddenly ruptures, causing catastrophic thrombus formation, totally occluding the artery and preventing blood from downstream. Symptoms: chest pain, shortness of breath, nausea, feeling faint, cold, sweat, feeling tired, arm, neck, back, jaw or stomach pain. Complications: heart failure, irregular heartbeat, cardiogenic shock, cardiac arrest. Causes: usually it is caused due to coronary heart disease. Risk factors: high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol. Diagnostic method: electrocardiogram, that is ECGs, blood test, coronary angiogram. Treatment: percutaneous coronary intervention, thrombolysis. Medication: aspirin, nitroglycerin, heparin. Prognosis: STEMI 10% risk of death, developed world. Frequency: 15.9 million at 2015. Mostly, myocardial infarction occurs due to the coronary heart disease. Risk factors which includes high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol level. The treatment of myocardial infarction is time critical. Aspirin is an appropriate intermediate treatment of suspected medicine for myocardial infarction. Nitroglycerins or opioids may be used to help with chest pain. However, they do not improve overall outcomes. Supplemental oxygen is provided or recommended in those with low oxygen levels or shortness of breath. Worldwide, about 15.9 million myocardial infarctions occurred in 2015. More than 3 million people had an ST elevation, MI, and more than 4 million had NSTEMI. STEMIs occurs about twice as often in men as women. Myocardial infarction each year in United States. In the developed world, the risk of death in those of MI for a given age have decreased globally between 1990 and 2010. In 2011, an MI, that is myocardial infarction, was one of the top 5 most expensive conditions during inpatient hospitalizations in US, with a cost of $11.5 billion for 612,000 hospital stays. Rate of deaths from ischemic heart disease has slowed or declined in most high-income countries, although cardiovascular diseases still accounted for 1 in 3 of deaths in US in 2008. For example, a rate of death from cardiovascular disease have decreased almost a third between 2001 and 2011 in United States. In contrast, IHD is becoming a more common disease of death in developing world. For example, in India, IHD had become the leading cause death by 2004, accounting for 1.46 million deaths, that is 14% of total death, and deaths due to HIV were expected to double during 1985 to 2015. Globally, disability adjusted life years lost to ischemic heart disease are predicted to account for heart disease totally in 2030, making it a second most important cause of disability after unipolar depressive disorder, as well as leading cause of death by an issues. Thank you guys. Thank you for spending time with me.